Mission trips are important because it's just a unique opportunity to help people in a selfless way, people that really would have no other hope otherwise. These are patients that are poor and come from countries where there really is no social service or welfare program. And in many of the countries that we work in the Philippines, if the patients don't have money, they're not going to get their operation. They're peasants, they're rice farmers. If they're lucky, they're rice farmers. If they're lucky, they have some land. Could never afford the trip nor the cost of the health care, so it really changes their life.
I'm Noni Labalan from Paranas, Western Samar, a retired teacher. My retirement was not designated by Department of Education because of my deficiency in sight. Now I'm suffering from poverty, discrimination, and a lot of trouble. But then, I do not surrender myself. I keep on moving. I keep on looking for somebody who will help me. And now, the group of yours was the one who gave us the blessings. Thank you, Master.
We're going to do it. Yeah, because it's probably a big pleomorphic adenoma. It rides up on top of the mandible, so it's not a deep lobe or anything like that. So it'll be a nice case.
I think the idea is that folks get into healthcare professions to help their fellow man, to be of service, to heal where you can, to comfort always, and to provide healthcare, to maintain health. And you're comfortable doing that where you work, and an extension of all that, a manifestation of the kind of spirit that moved you to get into that kind of work to begin with is how people gravitate towards medical mission work. They're drawn to that because they know that they can do good elsewhere. They just have to find a way to do so, and medical mission work facilitates that kind of spirit of altruism. The vision to do something starts with one person, and then the expression requires that other folks agree, abide by the same spirit, participate in the same work, and go do the work that they are comfortable with and familiar with and would gladly do for free. When there is that difference in perspective that occurs to you, then you wind up doing it again. It reinforces that good feeling. It reinforces that you know you're helping your fellow mankind, and it becomes habit forming. It's like, well, I know this is important, I know this is a good thing. Next thing you know, they're bit by the same bug. And after a while, you have a core group of folks who are engaged in the same mission. They have the same vision, they have the same motivation. They work together as a tight group, they get things done. When you have that kind of group of people involved in mission work, you can actually do a lot of good.
My name is Dr. David Ong. I'm a dentist, and I've been part of the trip for about the last 5 mission trips. I think mission trips are important because these people don't have access to care. It's some things that we take for granted here in the U.S. Here, there are places with no health care, and that's important to me because we're in a position to help others. Most Filipinos are grateful for what we do. Rarely would I find somebody that did not thank us. And you can see it in their eyes that they'll say thank you, and that's rewarding, I think. That's priceless. part of being a healthcare provider is you should at least do a mission trip because you're blessed with these skills or at least the capabilities of doing one. Missions are really a work of the heart.
Bernie. Good. Hi, Bernie. How you doing? Is it okay if I take your picture? Is that right, Bernie? Okay. We'll make you famous here, Bernie.
Sorry, Bernie, this smells bad. Big deep breaths.
This is an opportunity to do a fairly simple operation where you can overnight change the patient's life, where you don't need to have high-tech x-ray equipment or anything. It's just good anesthesia and some suture and good post-operative nursing. And overnight, the child can be accepted into the community. Well, it's always fun or special to be there when the baby first is seen by the mother. And they're always in tears. Sometimes they don't believe it's their child. Some don't think it's their child. They're just so used to seeing their kid with a deformity that when they finally see the child, repaired, there's disbelief it's even their child. It's kind of interesting because the natural thing for many children would be to fear surgery. And yet we see many of the kids that have cleft lip that are a little bit older who are enthusiastic. They're excited about their surgery that day because they just know it's going to change their lives.
I am a mother of Leonard Basherto. I would like to say to thank you of Minnesotan Foundation to successful the operation of my son.
I have a woman in a ponytail that needs to go over for a consult for OBGYN.
Okay.
So if you take care of that, that'd be great.
Certainly. All
Okay,
right.
thank you. So, my role in the clinic is to make sure that we have good patient flow to the doctors. We have a lot of patients we're going to see every day. We want to make sure we get all of them in front of a doctor and efficiently. And also the doctors have issues where patients have to have a referral or need a secondary procedure such as an x-ray or a labs or something. We make sure that those people are well taken care of, know how to get to the hospital or are taken to the hospital, and then followed up with so that we make sure we do a good job of taking care of them. So the patients really matter. It's important that we really do a good job with them.
The advance team arrived about 6 days before the opening of the mission, and we started with 800 boxes, along with a lot of equipment, beds, supplies for the hospital. And over the course of 5 days, we distributed them to the various sites, Bruce leading the supply effort And we came in here into this covered area and set up for the outpatient where we will handle about 800 patients every day. This is the eye clinic, and we were fortunate enough to be able to have a total of about 3,500 pairs of glasses. Many of them were collected by students and staff at Champlain Park High School and a number of community members that live in the Champlain northern suburbs, Brooklyn Park of Minneapolis. And they reached out to the community and were able to collect all of these glasses so that they could come here to the people of the Philippines who have very, very few glasses of their own. Every patient who comes to the outpatient clinic when they register is getting some rice. Each and every one about 800 a day. We went to some of the tent villages where people had been displaced from their homes because of the typhoon, and we distributed supplies, and the people were so appreciative and so gracious. Even to get just a very little bit made a big difference to them. It does matter a great deal.
The amount of work to put together a team like this is unbelievable. I mean, my role has been as a surgeon, but I have the easy, fun job because all surgeons like to operate. And fortunately, Teresa and Bernard have done so much work for the Philippine missions, it's almost a full-time job. And I also think it makes a big difference working with groups where they've bought their own ticket, they've made the sacrifices. It's a different feel-good feeling when you're with a bunch of people where everybody's made a sacrifice to be there. Many times it's the non-medical people who are making the biggest contribution and doing the most work, because I have no problems finding plastic surgeons who want to go on these missions. But to find people who are willing to do the hard work of organizing the missions, that's a real challenge, because that means months of work before, getting the equipment down, making arrangements with the logistics, making arrangements with where we're going to stay, making arrangements with how we're going to get from the airport to the hotel, how the meals are going to be taken care of, all those things you do that most surgeons have no interest in dealing with those things. They just want to go down and operate. That's what they do. That's fun. They are doing some work as far as making arrangements to have the sutures and the materials they need, but this is a very easy job compared to the hard work that goes on for a year. I mean, the date for this Philippine mission was known a year in advance, and the work as far as organizing, fundraising, and doing other things started at least a year ago. So this is the biggest challenge if we want to expand upon these programs or have more missions. It is not so difficult to find physicians willing to do it. It is hard to find organizers who are really skilled at putting this together because it just takes so much time and so much work. For my wife Naomi, for a couple months before on many missions, it's almost a full-time job.
So people wait a long time for mission groups to come by. And it's unfortunate because what happens is pathology can be pretty severe, pretty advanced, before medical help, surgical help can be given. But folks are very grateful, and I think that when that kind of news goes around, it generates excitement, and it just generates crowds that come on over to be treated, to be dealt with, cared for by mission groups.
Thanks to come in Qatar, man. Thank you.
Many thanks, no? You know, it's ended a blessing for all of us here to have some persons who are like Dr. Cabral and his members of the Pell Minnesotan Medical Association, that we have this kind of personalities who are really dedicated to help and assist our poor people in our province.